Hello, my name is Eric Botts, and I am a practicing optometrist. I help many doctors and their staff efficiently file insurance claims and maximize their reimbursement. I know there are many practices that struggle to get paid. I am offering you a solution to the problem of filing your Medicare insurance claims. Where do you begin? Here are 4 scenarios that you can choose from to ensure that you are maximizing your insurance reimbursement. You choose which one is best for you. So scenario number 1. This is not the most efficient way to submit claims, but easy to access. You're going to utilize a clearinghouse like Gateway or ENS. Those are 2 that I've used in the past. Some requirements here for you and your staff, though, is you must understand how to code and use the modifiers. It's a slow and inefficient because you have to put the information into their website. You have to submit secondary insurance claims. You have to resubmit denied claims after you've researched why they were denied. And then you have to send a bill to the patient for the balance due. So you have to hire, you have to train, and you have to maintain a billing person in your office, unless you, the doctor, are going to do this yourself. Here's websites and information for 2 of the clearinghouses that I mentioned earlier, the ENS Ingenix and the Gateway. Scenario number 2, this is much more efficient. You're going to utilize practice management software. You're going to connect to a clearinghouse. You still have to understand coding and modifiers. You're still going to submit claims to secondary insurance. You're going to send bills to the patient for balance due, and you're going to resubmit any denied claims after you have researched them. You need to hire, you need to train, and maintain a billing person in your office. Now, this is efficient because it utilizes practice management software, so you don't have to type in the patient's personal information more than once. Scenario number 3. This is the easiest, most efficient way. You're going to utilize practice management software. You're going to hire a billing service, and you're going to connect to a clearinghouse. You, the doctor, only have to complete the exam and document your diagnosis and procedure codes. Then your billing service will submit the secondary claims, resubmit denied claims after they research them, and bill patient for any balance due. You do not have to hire or train or maintain a billing person. There's no need to do that because the billing service will access your claims over the internet. Therefore, you don't have to have a billing person on the premises. This is the easiest and most efficient way, especially if you don't have trained billing staff in your office. Now, I'm going to tell you that not having a billing specialist in your office is not an excuse to not adopt the medical model of optometry. There's no reason not to submit medical claims, even if you don't have a billing specialist in the office. Here's an easy way to do it. And this last scenario, number 4, this is easy and low cost because no practice management software is required. You utilize a billing service. The doctor only has to complete the exam and document the diagnosis and procedure codes. You then send the claim and a copy of the insurance to your billing service, either through an email or through a fax. The billing service will then submit the secondary claims, submit denied claims after researching them, and bill the patient for any balance due. And you, the doctor, do not need to hire, train, or maintain a billing person in your office. So easy for you, low cost, and an excellent way for any doctor without staff that's knowledgeable on the process of submitting claims to get started with the medical model of optometry. Another option for Medicare only is to download PCH Pro 32 from your local Medicare carrier. However, it does require that you have a computer, in most cases a dial-up modem. You are going to either do the claims yourself, doctors, or you're going to hire, train, and maintain a billing person. You need to understand the codes and modifiers. You're going to have to submit secondary claims. You're going to have to resubmit denied claims, and you're going to bill the patient for balance due. And remember, this is for Medicare only. This isn't going to work for Blue Cross Blue Shield or any other medical insurance claims. So where do I begin? You're going to do this in-house, or you're going to outsource your medical billing? A few questions you need to ask yourself. Is your staff well trained on filing insurance claims? Do you have enough staff to file insurance claims? Is your staff well trained on researching denied claims and resubmitting claims? And what happens if your billing person leaves? These are all questions you need to answer before you decide whether you keep this in-house or you outsource it. The advantages of outsourcing is that you have a team of experienced billing specialists working for you instead of depending on just one person to do it all. This allows you and your staff to focus on patient care, the highest quality patient care. Let somebody else deal with the headaches of billing insurance. So you decide. You have choices. I gave you 4 scenarios that you can look at. There's no excuses for not submitting medical claims. One of those scenarios will work for you. You also can switch. If you start in one scenario and you decide it's not working for you, switch to another. You choose the one that works best for your situation. OBC billing specialists can submit your primary claims, your secondary claims. We can bill the patient for any balance due. We can even get you credentialed for any insurance panel you choose to apply to. You can reach us at 309-836-2456 or email me at drvision@claimdoctor.net for all of your billing and insurance needs.